Borderline personality disorder, recognizing the signs and seeking help. Borderline personality disorder is a mental illness that severely impacts a person's ability to regulate their emotions. It impacts the way they think and feel about themselves and others. It is a person's instability of emotions, self-image, and relationships. When people lose their emotional control, their self-control is lost, and this seriously affects their personality and relationship with others. This also results in impulsive behavior. The patients of BPD also suffer from many visible and invisible side issues. It's a severe mental illness, but it can be effectively managed and controlled with the right treatment. But for this to happen, it must be identified first as early as possible. BPD has many symptoms that can help identify it. Signs and symptoms of BPD. 1. Intense and unstable emotions. As said before, people suffering from BPD are pretty unstable when it comes to emotions. They have frequent mood swings and changes in feelings towards others, and even themselves. They are not sure about how they see themselves. Their emotions are not only unstable but also intense, as they are unregulated and cause physical aggression as well. 2. Extreme thinking or splitting. BPD patients view things in extreme ways. For them, the situations and people are either all good or all bad. There is no in between. This kind of behavior is called splitting. This splitting can lead to increased complications in their relationships. 3. Unstable self-image. People suffering from BPD have an unstable view of themselves. This means they are uncertain about themselves. They are confused about who they are and what they stand for. They may also have a negative image of themselves, resulting in blaming and criticism. This instability of oneself can cause serious disruptions in their life. This makes them highly sensitive to others' opinions about themselves, as they are not sure about who and what they are. 4. Fear of abandonment. People suffering from borderline personality have an intense fear of abandonment. This is partly because they don't want to be lonely. They may react extremely when they get the impression of being abandoned. They can overreact to even small missteps, considering them as an indication of being abandoned. For example, if they have to meet someone and that person delays the meeting, they might get angry considering it as rejection. 5. Anger. Anger is a common symptom in BPD patients, as we know that they are unable to control their emotions, and the same goes for anger. They can get furious about even small things. When they perceive that their sense of self or relationship is in danger, they can react aggressively. They may also feel embarrassed or guilty after their anger outburst and reinforce their feeling of being bad. 6. Impulsive behavior. BPD patients exhibit impulsivity in their actions and behavior. Their impulsive behavior can be observed in different aspects. They may fall prey to substance abuse and indulge in drugs to avoid their emotional pain. They can also harm themselves by engaging in impulsive acts of self-harm in the tussle of managing their emotions. Besides these instances, their impulsivity may also be observed in their spending or even driving. 7. Changeability. The patients of BPD have irregular views and thoughts about others. They tend to change their views dramatically and suddenly. They may be liking someone one day and detest them the other day. Their attitude can change based on their perception of others. If they think the other person is supporting them, they may behave well with them. And if they feel that they are being ignored or rejected, they can suddenly become angry. 8. Difficulty in relationships. BPD patients have much difficulty maintaining good relationships with others. As they are highly unstable, their views and behaviors keep changing toward others, and this causes strains in their relationships. They get easily furious with their friends and family for small things. These things are some of the reasons they face difficulties in their relationships. 9. Chronic emptiness. Another symptom in patients with BPD is chronic emptiness, as they are unsure about everything and especially themselves. They feel as if they are hollow and empty. This symptom is directly related to an unstable self-image. The lack of understanding of who they are leads to this feeling of emptiness. Seeking help. Borderline personality disorder can be identified through these symptoms. The first step after identification is to seek help. You should not be hesitant, even for a minute to call for help. The earlier you call, the better is it. Delaying and wasting time can cause more pain. Thank you for watching the video. Please like, share, and let us know your thoughts in comments box.